The moment you turn 50, your body starts sending signals, subtle at first, then increasingly persistent. You may not notice it right away, but one day you're standing in front of the toilet and something feels different. The flow isn't as strong as it used to be. You finish, but there's still this nagging feeling that your bladder isn't completely empty. And at night, you wake up once, then twice, maybe even 3 times to pee. At first you brush it off. It's just aging, you tell yourself. It's normal. But what if it's not? What if your body is trying to warn you about something serious, something that could get worse if ignored? Every year, millions of men worldwide face this exact scenario, yet few take action before it's too late. What starts as a minor inconvenience can escalate into something far more dangerous. A swollen prostate, blocking your urine flow, painful infections, or even the silent progression of prostate cancer. And here's the scary part. Many of these conditions develop without obvious symptoms until the damage is already done. So if you've noticed any changes in your urination patterns, this is your wake-up call. One of the first warning signs that your prostate might be in danger is a weak or interrupted urine stream. Think about it. Your bladder is full, but when you start to pee, the flow is hesitant, slow, or even stops and starts unpredictably. This happens because the prostate surrounds the urethra, the tube that carries urine out of your body. As the prostate enlarges, whether from benign growth, inflammation, or something more serious, it puts pressure on this passageway, making it harder for urine to pass through. Imagine trying to squeeze water through a bent garden hose. No matter how much pressure is behind it, the flow struggles to get through. Now here's where it gets worse. If your urine is struggling to pass, your bladder has to work overtime. Over time, this can lead to bladder damage, infections, and even kidney issues. That's right. What seems like just a slow stream could be setting the stage for far more serious problems. And if you've ever had that frustrating feeling of still needing to go, even right after peeing, that's another telltale sign that your prostate might be the culprit. When the bladder isn't emptying properly, residual urine can sit there, creating the perfect breeding ground for bacteria. This dramatically increases the risk of urinary tract infections, UTIs, bladder stones, and chronic inflammation. But let's talk about nighttime urination, because this is one of the most common and most ignored symptoms. You go to bed, and a few hours later, you're up again, dragging yourself to the bathroom in the middle of the night. It starts happening once in a while, then every night, then multiple times a night. This condition, known as nocturia, can be more than just an annoyance. It's often a red flag for an enlarged or irritated prostate. And it's not just about the inconvenience. Studies have shown that frequent nighttime urination significantly increases the risk of falls and fractures in older men due to sleep disturbances and drowsy, unsteady trips to the bathroom. And sleep deprivation, that leads to fatigue, memory problems, and even a higher risk of heart disease over time. If you found this information valuable and want to take control of your prostate health, hit the like button, subscribe, and share this video with other men who need to hear this. Your health is in your hands. Don't wait until it's too late. Now, I want to hear from you. Drop a comment below and write, "I want to live better," if you're ready to make your health a priority. Let's spread awareness and take action together. What about burning, pain, or discomfort while urinating? This symptom is often dismissed as dehydration or irritation from something you ate, but it can actually indicate prostatitis, an inflammation of the prostate that can be bacterial or non-bacterial. If left untreated, it can lead to chronic pain, difficulty urinating, and even long-term complications with sexual function. Then there's the most alarming sign of all, blood in your urine. It's one thing to experience minor discomfort or changes in flow, but the moment you see red, even a tiny streak, that is an emergency signal from your body. Blood in the urine, known as hematuria, can be a symptom of advanced prostate disease, bladder infections, kidney problems, or even cancer. The scary part? Sometimes the blood isn't visible to the naked eye, and only a medical test can detect it. This means many men are walking around with internal issues they have no idea about until it's too late. So what does all of this mean for you? It means that your body is speaking and it's time to listen. A weak stream, frequent urination, discomfort, or blood in your urine aren't just random changes. They're warnings, and they will not fix themselves. Ignoring them won't make them disappear. If anything, the longer you wait, the worse the problem becomes. And this is just the beginning. Now that you know the warning signs, the next question is, what's causing them? What's really happening inside your body that's triggering these symptoms? And most importantly, what can you do about it before it's too late? Let's break it all down in the next section. As men age, their bodies undergo many changes. Some are visible, like graying hair or wrinkles, while others happen silently inside. One of the most overlooked yet critical transformations occurs in a small but powerful gland, the prostate. Nestled just below the bladder, this walnut-sized organ plays a crucial role in reproductive health. But after 50, it can start to cause more trouble than most men expect. What was once an unnoticed part of the body suddenly becomes a source of frustration, discomfort, and even serious health risks. But why does this happen? What exactly is going on inside your body that's making it harder to urinate, causing discomfort, or even putting your life at risk? The answer lies in 3 major prostate-related conditions: benign prostatic hyperplasia, BPH, prostatitis, and prostate cancer. Let's start with the most common one, benign prostatic hyperplasia, or BPH. This condition is practically a rite of passage for men over 50. By the time you hit 60, the chances are high that your prostate has already started to enlarge. But why does this happen? Scientists believe it's linked to hormonal changes that occur with aging. Testosterone, the male sex hormone, gradually decreases, while another hormone, dihydrotestosterone, DHT, continues to be produced. This imbalance triggers an increase in prostate cells, making the gland grow larger over time. The problem is that the prostate sits right around the urethra, meaning that as it expands, it squeezes the urinary passage, making it difficult for urine to flow freely. At first, you might not even notice the symptoms, but over time, the signs become harder to ignore. You may find yourself struggling to start urination, feeling as if your bladder isn't fully empty after going, or waking up multiple times a night to pee. The worst part? This isn't just an inconvenience. It can have serious consequences. A persistently enlarged prostate can lead to bladder infections, kidney damage, and even complete urinary retention, where you suddenly find yourself unable to urinate at all. Imagine being in excruciating pain, rushing to the hospital, only to have a catheter inserted because your bladder simply can't empty itself. It's a frightening reality that many men don't realize until they experience it firsthand. But BPH isn't the only culprit behind prostate troubles. Another common issue is prostatitis, which, unlike BPH, can affect men at any age. Prostatitis is an inflammation of the prostate that can be caused by bacteria or non-bacterial factors such as stress, muscle tension, or an immune system response. If you've ever experienced a sudden burning sensation while urinating, intense pain in the lower abdomen, or even fever and chills, you might have had acute bacterial prostatitis, a condition that requires immediate medical attention. However, chronic prostatitis is even trickier. It develops slowly over time and causes persistent pelvic pain, discomfort while sitting, and unexplained urinary issues that come and go. Some men suffer for years, visiting multiple doctors before finally getting a diagnosis. The worst part? The cause isn't always clear, making treatment a frustrating process of trial and error. Many men with chronic prostatitis describe the condition as a constant nagging pain that disrupts daily life, affects intimacy, and creates emotional distress. If you've ever had unexplained discomfort in your lower back, testicles, or between your legs, it could be your prostate sending out distress signals. Then there's the most serious concern, prostate cancer. This is the second most common cancer among men worldwide, and what makes it particularly dangerous is its ability to remain silent for years. Unlike BPH and prostatitis, which often come with obvious urinary symptoms, early-stage prostate cancer may not cause any noticeable signs. It quietly grows within the gland, often going undetected until it reaches a more advanced stage. Some men only discover they have it after experiencing bone pain, unexplained weight loss, or extreme fatigue, by which point the cancer may have already spread. The most frustrating part? Many men ignore early warning signs because they assume it's just a normal part of aging. They tell themselves that waking up at night to pee, struggling with a weak urine stream, or feeling occasional discomfort isn't a big deal. But sometimes these seemingly minor symptoms can be the first indicators of something far more serious. Don't ignore your health. Take action now. Comment "I want to live better" below if you're ready to make a change. What makes prostate cancer even more complicated is the fact that not all cases are aggressive. Some grow so slowly that they never cause harm, while others spread rapidly and require urgent treatment. The key is early detection, something that far too many men put off. A simple PSA blood test and a digital rectal exam could mean the difference between catching the disease early, when it's highly treatable, or discovering it when options are far more limited. But here's the good news. While BPH, prostatitis, and prostate cancer all sound terrifying, they are not inevitable. There are steps you can take to reduce your risk, manage symptoms, and protect your prostate health. You don't have to wait until the symptoms become unbearable or until a doctor gives you bad news. You can start making changes now. So, what exactly can you do? What habits, foods, and lifestyle choices can keep your prostate functioning properly for years to come? The answer is surprisingly simple, yet most men overlook it, and that's exactly what we're going to dive into next. Because when it comes to prostate health, prevention is always better than treatment, and it starts with understanding what your body truly needs. There comes a moment when every man over 50 asks himself a crucial question. Is my prostate really in danger? You may have noticed the warning signs: frequent trips to the bathroom, a weaker stream, or that uncomfortable feeling of incomplete emptying. But how do you know if it's something serious? Is it just a part of aging, or is your body trying to tell you that something is wrong? The truth is, far too many men ignore these signals until their symptoms reach a breaking point. But the key to protecting your health lies in one simple action: getting tested before it's too late. The first and most well-known test is the digital rectal exam, DRE. Let's be honest, many men hesitate at the thought of this exam, but here's the reality. It takes less than a minute and could save your life. A doctor inserts a gloved, lubricated finger into the rectum to feel the prostate's size, shape, and texture. Why is this important? Because while some prostate conditions cause noticeable symptoms, others, like early-stage prostate cancer, can grow silently without any warning signs. By feeling for hard lumps, irregularities, or swelling, a doctor can detect potential problems that might not yet be showing up in other tests. And here's a fact that might surprise you. In many cases, prostate cancer is first detected through a DRE, even when the patient's blood work looks normal. But a physical exam alone isn't enough. That's where the PSA, prostate-specific antigen, blood test comes in. This test measures the level of a protein produced by prostate cells. If your PSA levels are elevated, it could be a sign of prostate enlargement, inflammation, or even cancer. However, it's not always that simple. PSA levels can also rise due to factors like recent sexual activity, cycling, or even a simple urinary infection. This is why doctors don't rely on PSA alone, but rather track changes over time. A rapidly increasing PSA level can be a red flag that something more serious is developing. If a doctor finds something suspicious through a DRE or PSA test, the next step is imaging tests or a biopsy. An ultrasound or MRI scan can provide a clearer picture of what's happening inside your prostate. But the definitive way to diagnose prostate cancer is through a biopsy, where a small sample of prostate tissue is taken for analysis. While the idea of a biopsy may sound intimidating, it's the only way to confirm whether abnormal cells are present. And here's a crucial piece of information. Not all prostate cancers need aggressive treatment. Some grow so slowly that doctors may recommend a strategy called active surveillance, where the cancer is closely monitored rather than immediately treated. This prevents unnecessary surgeries or radiation for slow-growing tumors that may never actually become life-threatening. But what about the less obvious signs that something is wrong? Many men assume that as long as they don't have severe symptoms, they're in the clear. However, what they don't realize is that prostate issues don't always start with pain or noticeable discomfort. Some early indicators can be much more subtle: feeling constantly tired, experiencing unexpected weight loss, or noticing changes in sexual function, like a decline in libido or difficulty maintaining an erection. These symptoms might not seem directly connected to the prostate, but they can be early warning signs that something isn't right. And here's another shocking truth. In some cases, the first noticeable sign of prostate cancer isn't urinary trouble, it's bone pain. This is because prostate cancer, when left undetected, often spreads to the bones before causing severe urinary symptoms. If you've been dealing with persistent lower back pain, hip pain, or discomfort that doesn't seem to have a clear cause, it's worth checking your prostate health. Now you might be wondering, how often should you get checked? The general recommendation is that men over 50 should have a PSA test and DRE annually. But if you have a family history of prostate cancer, you should start even earlier, around age 40-45. Studies show that if your father, brother, or uncle had prostate cancer, your risk doubles. If multiple family members had it, the risk is even higher. Genetics play a significant role, and knowing your family history could make all the difference in catching a problem early. So, what happens if you get tested and your results aren't perfect? The most important thing to remember is this: a high PSA or an abnormal DRE doesn't automatically mean cancer. Many cases of prostate enlargement, BPH, and inflammation, prostatitis, can cause similar findings. That's why follow-up tests are crucial. The biggest mistake men make is ignoring a bad result instead of taking action. The sooner you know what's happening inside your body, the more options you have. And now, let's talk about something just as important as getting tested: what you can actually do to prevent prostate problems in the first place. Because while some factors like aging and genetics are out of your control, there are powerful steps you can take to keep your prostate healthy for years to come. Let's explore the science behind lifestyle changes, diet, and habits that could make all the difference. Because when it comes to your health, prevention is always better than treatment. Imagine a future where you never have to worry about waking up multiple times a night to urinate, where you don't feel that uncomfortable pressure in your lower abdomen, and where the fear of prostate issues no longer lingers in the back of your mind. The truth is, while aging is inevitable, suffering from prostate problems doesn't have to be. The good news is that you have more control over your prostate health than you might think. It's not just about luck or genetics, it's about the choices you make every day. And the sooner you take action, the better your chances of preventing the complications that millions of men face. The first and most powerful way to protect your prostate is through your diet. The foods you eat can either fuel inflammation or help fight it. One of the most well-researched compounds for prostate health is lycopene, a powerful antioxidant found in tomatoes. Studies show that men who consume high amounts of lycopene have a lower risk of developing prostate problems, including cancer. But here's the catch: your body absorbs lycopene better when tomatoes are cooked. So tomato sauce, soup, and even ketchup can be beneficial. Another crucial nutrient is zinc, found in pumpkin seeds, nuts, and seafood. Zinc plays a key role in regulating prostate function and can help reduce inflammation, which is one of the main contributors to prostate enlargement. But just as some foods can protect your prostate, others can harm it. Diets high in processed foods, red meats, and excessive dairy have been linked to increased prostate issues. Why? Because these foods tend to increase levels of insulin-like growth factor, IGF-1, a hormone that has been associated with prostate cell overgrowth and even cancer development. If you regularly consume fast food, deep-fried snacks, and sugary drinks, you might be feeding the inflammation that contributes to prostate problems. A simple switch to more plant-based foods, lean proteins, and healthy fats like those found in avocados, olive oil, and fatty fish can make a world of difference. Beyond diet, another critical factor is staying active. You've probably heard that exercise is good for your heart, but did you know it's just as important for your prostate? Regular physical activity has been shown to lower the risk of prostate enlargement and cancer. It's not just about hitting the gym. Even moderate activities like walking for 30 minutes a day can improve blood circulation to the pelvic area, reduce inflammation, and help maintain healthy hormone levels. Resistance training such as weightlifting or bodyweight exercises can also be beneficial because it helps balance testosterone and insulin levels, two factors closely tied to prostate health. And let's talk about hydration, something so simple yet so overlooked. Many men don't drink enough water throughout the day, which can lead to urinary tract infections, kidney stones, and increased bladder irritation. If you've ever noticed that your urine is dark yellow or has a strong odor, it's a sign that your body needs more water. Aim for at least 8 glasses a day to keep your urinary system functioning properly and to help flush out toxins that can contribute to inflammation. Another often ignored but crucial aspect of prostate health is managing stress. You might not think that stress has anything to do with your prostate, but the connection is real. Chronic stress leads to increased levels of cortisol, a hormone that, when elevated for long periods, can contribute to hormonal imbalances, immune system suppression, and even prostate inflammation. Have you ever noticed that when you're under a lot of stress, you experience more tension in your lower abdomen or pelvic area? That's because stress can tighten pelvic muscles, leading to urinary problems and even worsening symptoms of prostatitis. Simple practices like deep breathing, meditation, or even taking time to unwind with a hobby can go a long way in protecting your prostate. Of course, no matter how well you eat, exercise, or manage stress, regular checkups with your doctor are non-negotiable. Many men avoid seeing a doctor until their symptoms become unbearable, but by then, the damage may already be done. Screenings like the PSA test and digital rectal exam can catch problems early, sometimes before you even have symptoms. The earlier an issue is detected, the easier it is to manage, and in many cases, early intervention can prevent the need for aggressive treatments. If you're over 50, make sure to schedule an annual prostate health checkup, and if you have a family history of prostate cancer, start even earlier. It's easy to ignore prostate health until something goes wrong, but by then, you may be facing surgery, medication, or a drastically reduced quality of life. The reality is that prevention is always easier than treatment. And the best part, the same habits that protect your prostate, eating well, staying active, reducing stress, and getting regular checkups, also benefit your overall health. You'll feel stronger, more energized, and more in control of your body. So now you know the warning signs, the causes, the tests, and most importantly, the steps you can take today to protect your prostate and maintain your health for years to come. The question is, what will you do with this information? Will you wait until the symptoms get worse? Or will you take action now and start making changes before problems arise? The choice is yours. But remember, your future self will thank you for the decisions you make today. If this video helped you understand the importance of prostate health, make sure to like, share, and subscribe so more men can learn how to take control of their health before it's too late. Thank you for watching, and remember, your health is in your hands.